Greetings, it's Alex Scher for the Shelburne Freelancer. I'm here today at Shelburne Town Pharmacy, and I'm here today with...
Sanjay Lekhi.
Hello, good morning.
Good morning, Alex. How are you doing?
Good, thank you. It's very nice of you to head into March with a lot of really great tips on how to keep your heart healthy, since February was Heart Health Month. So moving into March with best foot forward, I understand you have some tips for us.
Absolutely. I can help you or help everybody and also educate myself on the new things.
Excellent. What's the biggest cause of heart problems?
So let me break it down into two things. One is the modifiable cause and one is the non-modifiable. Modifiable means like what we can do ourselves, diet and lifestyle. And if we are eating some fat diet, then that is definitely one of the biggest risk factors. Then the second thing is if we are smoking, if we are having too much alcohol and extreme stress, not sleeping well. So these are the factors which contribute to the heart health.
And what are the most common medications prescribed for heart issues? And are there harmful side effects people should be watching out for?
I am really happy to say that the medications and the group of medications which are quite older, they are actually in use more often nowadays. And then say some people use water pills, example like hydrochlorothiazide. The other group is calcium channel blocker, which is like nifedipine or amlodipine. The other group is ACE inhibitors, so ramipril or parenteropril. Then there is another class of medications, they're called as ARBs. So like example is telmisartan or losartan.
Now we understand there's very common indications of a pending heart attack. Are the signs different for men than they are for women?
The impending heart attack is difficulty breathing, tightness in the chest, usually in the center of the chest, and it's a feeling of fullness or tightness. And the second, it could be pain in the neck, jaw, in one arm or in both arms. Other symptoms could be nausea, lightheadedness, and sweating. So the answer to your question, Alex, is a little bit of a difference in the signs. Most women don't feel tightness of chest, but they feel difficulty of breathing. And when I was reading in one of the articles from Harvard Medical School, and they were saying that the tightness in chest usually comes later in the symptom list.
Interesting. But over the years, are more women having heart attacks than men?
The ratio is approximately same. So although the men genetically is more prone to the heart attacks, but the actual percentage is same.
So are more women than men actually having heart attacks?
The ratio is the same, but men are more genetically predisposed to that.
Now, what about the old adage, an aspirin a day keeps heart attacks away? And is it the first thing to take if you feel a heart attack coming on?
That is actually true, unless a person is allergic to aspirin. As soon as they have suspicion that they're going to get a heart attack or they're going through that, then they can chew 181 milligram aspirin so that it can work faster, and then call 911 after that. How aspirin works is it reduces the stickiness of the platelets together, so that they reduce the risk of making a clot.
So for somebody trying to be health conscious, what are the best vitamins for a healthy heart?
Happiness.
Good answer. Well, what's your best advice to reduce the risk of heart attack?
So what we would say is fiber is a good source. So we can get from a lot of sources like lentils, legumes, and grains, fruits, vegetables. So they kind of reduce the cholesterol, and they kind of reduces the cholesterol with body soaks from the food sources. And then second is fish oils are good sources, and CoQ10, which is coenzyme Q10, is a good source as well to get the heart healthy vitamins. But I would say if we carefully check our diet or consume our diet, and then we really don't need any multivitamins from over the shelf, our needs can be satisfied.
So if somebody is just, trying to do research online and see if they have heart issues, what do you have to say about that? Like, you're providing very useful information, but what should they actually do?
So as we said, if they have tightness in the chest, shortness in breath, pain in the neck, in the jaw, or pain in one or both arms, then taking 181 milligram aspirin chewing is definitely the right step to do, and then call 911 after that. If they wanted to prepare so that they have knowledge for that, if this happens to them or this happens to their near and dear ones, then there are a lot of websites they can go to, like Heart and Stroke Foundation is one of the best one. And then there is another one from the US, which is heart.org. So they give plenty of useful information and videos so that we can know what can be done beforehand.
And just for the record, what about consulting a doctor?
So I would say keeping the regular visit to the doctor is definitely a first thing everybody should do, because a preventative maintenance is always the best rather than having a treatment. So, and that is why we are lucky in Shelburne. We have a lot of doctors here, and then all have very good reputation in the community. So we are glad to have them.
So the internet is not a substitute for regular visits to the old doc.
Internet is okay if you just wanted to know how this stuff works, but self-diagnosis, I wouldn't do that.
Perfect. Thank you very much, and happy March to you.
Yeah, thank you, Alex.
Going forward with a healthy heart.
Okay, thanks a lot.
Thank you. This is Alex Scher for the Shelburne Freelancer, signing off.